So today we'll be talking about alcohol, drugs and mental health. Statistically, some of us on this webinar would have been touched by our own mental health challenges, such as depression, anxiety, which are very common now in Australian society. Globally, these are real common disorders that we're having to deal with on a global scale. I should say, if there's anything we discuss today or anyone feels uncomfortable with or it triggers any negative emotions, please, switch off your webinar, give yourself a break, have a glass of water, and any other techniques that you might employ with your own mental health plan and strategy to get yourself reset. We're also very open to hanging around or Jim connecting us with any of the participants should anyone want to have a chat to us individually after this webinar. Some of the things that we'll go through today. So we're going to examine the links between anxiety, depression and substance use disorders. We're going to learn to recognise the signs and symptoms of depression, anxiety and other psychological injury, both in ourselves and in others. I'll just touch on that. One of the key things with a lot of our workplace programs is we try and afford people the ability with how to self-analyse their own decisions that they're making in their lives and recognise problems within themselves, but also empower people with the tools and the knowledge around how to recognise problems in others. And then more importantly, how to approach these people, how to steer them into the right kind of conversation to get people towards support avenues. The most important thing around this stuff sometimes is bringing it to the surface, having a non-judgmental, empathetic ear that you can lend to someone. But then it's very important to learn how to actually steer people into the right support avenues too. We're going to recognise the links between depression, chronic anxiety and substance misuse. Gain an understanding of the nature of addiction. Ella will take you through a couple of slides from our workplace program there. Discuss the importance, as I said, on reaching out for help and advice and for alcohol and drug problems and for depression, anxiety and other mood disorders. We're going to touch on everything COVID-19 related. I mentioned some of it earlier in my introduction. And when you look at the impacts of isolation and lockdown, we've actually internally pivoted a lot of our internal research teams. Tim O'Brien, who you're very familiar with, he spent the last couple of months now really focusing on our kind of research efforts being focused on the impacts of social distancing, isolation and lockdown, the impact that kind of stuff is having on children. I can relate to my own personal situation. I've got a 4.5-year-old and a 10-week-old boy at home. I'm someone that's normally in the office probably 12 hours a day. So all of a sudden now I'm home. It's a wonderful time, and we will touch on how a lot of this can be looked at as a time to reconnect and to do good. But I would share just from my own personal experience, I've never experienced being in such a confined kind of environment with my family for such extended periods of time. And coupled with that, trying to keep the businesses going and all the other anxieties that come with having to adjust to working remotely. This is all kind of uncharted and new territory for many of us. So we've tried to put a lot of our efforts into researching this stuff in a way that, and Jim, I think, you'll appreciate this. The ADA approach has been, in particular to our mental health related content, we've tried to do it in a way that is not, we haven't tried to develop anything that's a clinical treatment guide or anything of the sort. We've tried to develop content in a way that people can easily connect with. There is a lot of content out there. Sometimes I feel the world is a little bit desensitized to the topic and the conversation of mental health. We need to talk more, but at the same time, we need to make sure people are able to connect. So we've tried to put together content from a perspective that's not really super clinical, although it's backed up by a lot of clinical research and advice underneath the surface, to try and help people not be intimidated by some of the content that we produce as well. Give them the ability to connect and to perhaps gain some knowledge that might help them in their management of anything mental health or substance misuse related. We're going to identify the psychological challenges of isolation and loneliness, how to guard against them, examine the mental health benefits of positive thinking. So we really want to try and share and leave with you today some positive information around a lot of our content. Learn to understand anger and how to manage it. Again, I can relate to my own personal experience. There's certainly been a heightened sense of anger at various times in my own approach to home at the moment. ADA as an organisation, we actually do a lot of work with groups like the firefighters, especially here in Victoria. The firefighters go through our alcohol and other drug programs and our mental health training. And some of the insights we're getting from those types of groups are pretty alarming. You know, there's things like, you know, call outs to suicide and self-harm are up significantly year on year at this time. And often it's the fireys that are called and first on scene to those types of tragic scenes. So some of those kind of things are a real reflection of the challenges that we're facing at the moment. You know, we saw early on quite publicly it being reported around gendered and family violence kind of spiking in that first week of isolation, but then really dropping away in terms of call-outs, which is another pretty scary statistic in itself, because people don't have anywhere to go. You know, they're not reaching out for the support services that are out there. So these are all things that we need to be acutely aware of, and the impacts of this kind of pandemic that we're currently in, and make sure that we're providing the tools and the resources for people to access the right level of support. And that's really where we'll finish, how to seek help, and both for yourself and for others that might be around you. So negative thinking, anxiety and depression. Again, we've just pulled out a little bit of content from some of our programs. Also, Ella, from some of our publications. Negative emotions, narrow thinking, and the problem becomes the only focus. Like walking with a stone in the shoe, all you can think about is the stone. Now, I'm sure we can all relate to this. You know, we all carry negative and positive emotional biases, but these can really influence our interpretation of the world, and really impact on our ability to cope in the world. I can certainly relate at my time through the last kind of couple of years of addiction. I was filled with so much negative self-talk. You know, on the surface, I had a really overinflated ego, which was my defense mechanism around all this stuff. And it really was the thing that didn't enable me to put up my hand and seek help. But I had no real self-love. You know, I didn't really have any sense of self-worth. I had a mind that was continually telling me that I was no good, that I was going to eventually live the life of a tragic addict, and all this type of negative self-talk were things that restricted my ability to seek out help. You know, when our negative thinking is crowded by negative self-talk and excessive worry, it can cause us to not only see catastrophe and negative outcomes in stressful events. It's so true. You know, if you're only telling yourself the negative things, it's very hard to see the solution. It's very hard to find any kind of optimistic view towards what you're trying to deal with in life. And, you know, we find that these excessive kind of worrying, chronic, repetitive, negative thoughts can indicate symptoms of deeper mood disorders, like post-traumatic stress disorder or depression. We've got a little fact. I think Ella likes to call out some facts as we go through some of our content, and we'll share some of these throughout the session tonight. 1 in 11 Australians suffer depression in any given year, and more than 1 in 9 will suffer anxiety. It's pretty high statistics when you think about it. Anxiety disorder. Anxiety is the most common form of mental disorder. Among Australians, adults, 1 in 8 women report an anxiety-related condition, and 1 in 10 males. Now, some dated data there, 2015, I think, Ella, it's the most up-to-date data that we've got around this stuff. Certainly from an ADA as an organisation, I should report, we've had over 30,000 people through our training programs now. We survey everyone on the other side of our training, and we can certainly back up this data with our own internal kind of statistics that we're still dealing with these challenges, never more so than the current climate in the world. Younger women aged 15 to 24 suffer anxiety-related conditions at twice the rate of men at the same age. You know, young females coming into the world, there's a whole range of other layers of stress that they need to deal with. Some signs around anxiety disorder: fatigue and chronic sleep, nightmares and flashbacks, avoidance, loneliness, feelings of inadequacy, panic attacks, easily startled, hyper alertness, you know, always being tense, irritability and shortness. I know myself, whenever I'm anxious, I'm quite short with anyone around me. I can certainly connect with that. Excessive worry, so back to that negative self-talk and thinking. You know, anxiety disorders consume your thinking, that fear and feelings of impending doom, you're never being able to see the good. They're things that can really get hold and take over someone's thought patterns. Now, Jim, I don't know if we're making this engaging at any point, or if I can see the chat box going off a little bit.
Yes.
Yep, you guys are on that.
We're on that.
Yep, okay, wonderful.
We've got plenty of people listening in. We've got 160 at the moment.
So we'll touch on depression now too. depression changes thinking, relationships, sleeping, eating, and enjoyment towards life. Terms like burnout and cracking the sads can obscure the illness behind the symptoms. Again, I can relate to my own personal experience here. An underlying depression really fueled a lot of my, my solution really being substance abuse in the end, was because of my underlying depression. And I always deflected it with terms like I've worked too hard or I've burnt myself out. It really, it caused me to avoid really looking within at what I had to face, and it certainly made me avoid the support networks that were out there. Intervention and treatment is very important. You can help. With my example, just by chance, someone was able to intervene through the process, which caused me to throw up my hands when I found myself on the edge of that balcony that day. Outside of that, I made it very difficult for people to kind of intervene in my life, but people didn't know what to do. And we often say at ADA, people will do what they do until they don't. And sometimes people aren't aware of how to approach someone around this. So one of the things that we go through often in our program is around how to recognize some of the signs in someone that might be suffering depression. So, someone expressing hopelessness, failure, persistent negative talk, uncharacteristic weight loss or weight gain, emotional fragility, so tearfulness and sadness. I've kind of seen emotional fragility, albeit in a temporary state of recent times when my partner was going through the last stages of pregnancy. Something would come on the TV and she would break down in tears, and that was a reflection of her emotions and her hormones and all that kind of stuff being out. But you've got to be aware of that stuff and look out for those signs in people. Intrusive negative thoughts, including thoughts of suicide and self-harm. If people are experiencing these thoughts, I encourage you to seek out help, talk to someone. If someone is expressing concerns or thoughts of this nature, it's very important that you take them seriously. And then, some of the stuff we want to touch on today, negative behaviours that affirm in people's lives. So drinking heavily, using drugs to mask negative feelings. When drugs and alcohol in particular become people's solution to this stuff, it's a very clear warning sign that there's something else underlying going on in their life that we need to try and support them through. Depression and chronic anxiety is strongly linked to thoughts of self-harm and suicide. We just reinforce that point. If people are experiencing those thoughts, please seek out help. And if someone's expressing those types of thoughts, please try and steer them into the right help if you're not the person to help them. Anxiety, depression, and substance disorders. Again, here's one of our little facts. Anxiety and depression frequently co-occur, they're comorbid with substance use disorders like drugs and alcohol and other mental disorders, chronic gambling, pain disorders. Anxiety and depression frequently co-occur with thoughts of self-harm and suicide. If untreated, the downward spiral can be very dangerous. Again, first-hand experience, it was certainly the journey, for me as an individual. So again, we really, encourage you guys to take note of these facts that we're calling out through tonight. Now, Ella, you're going to jump in and take us through a couple of these slides from our course material.
Yep, sure.
So everyone, I'll introduce you to Ella now. I'm probably sick of hearing my voice already.
No, well, thank you. Really an honour to be here and be part of this presentation. And I guess just as an intro, you can sort of see from the images up there, whether it's screen time, without a doubt, especially during isolation, the online gambling and sort of, being able to do that stuff from the privacy of our own homes, whether we're binge eating, whether we're over pouring that wine, whether we're drinking while we're working, not being able to have that sort of work and home life balance. Like, when is that time that we pick up the drink? If we do have a drink, what's acceptable or not? Are we sort of getting a bit worse? And, obviously boredom and loneliness are always going to be triggers or things that might find us wanting to fill up that time or fill up that space. And so at least being mindful that these are possibilities and being able to help ourselves fundamentally is why we say it really candidly, because we can all fall into these patterns. But the goal is to try and prevent that from sort of consuming us. So in terms of drugs themselves, what we do know about drugs, whether they're legal or illegal, they will usually come in one of three classifications. So you'd always have your stimulants. They speed up the central nervous system, that increase the heart rate and breathing. And up there on the screen, what you'd see that is a stimulant would be cocaine, methamphetamine, and ecstasy. They are the stimulants that are sort of shown up here for the illegal drugs. Depressants are another classification, slowing everything down, slow the heart rate down. Usually if a person is stressed out, if a person is worrying, if a person, you know, is trying to cope with those things, that is life. We may put a depressant in our system to slow everything down, to help us de-stress or to help us go to sleep at night, or whatever we sort of need, you know, in that moment. And up there we've got, obviously these are the illicit drugs, heroin and opium. Marijuana is also a depressant, GHB is a depressant, and synthetic cannabis officially falls into that depressant category. But it also borders on your hallucinogens, which is your third classification, distorts the central nervous system. So an individual might see things or hear things that aren't there. And alongside that, you've got your psilocybin mushrooms or your magic mushies, and LSD is also a hallucinogen. Moving on to legal drugs now, and it's always really important to note that out of all the drugs that are out there, it is legal drugs that are actually killing more Australians than any of the other drugs. Tobacco first, then alcohol, and then pharmaceuticals in that order are killing more Australians than any of the other illegal drugs that we just looked at. And when we do look at overdose deaths in Australia alone, in Victoria alone, I should say, out of all the overdose deaths that involved multiple contributing drugs, I can tell you that at least according to the coroner, at least 70% of those overdose deaths, one of the substances was a pharmaceutical, really highlighting the sort of issues that we've got going on at the moment around the legal drug use. We will look at alcohol in a second, but it's just always important to note that just because something is legal does not mean that it can't cause us harm. You know, that's really fundamentally what it's always about. What we might do is compare one to the other and think it's not as bad because it's legal, but ultimately what we do know is that legal drugs are causing more harm out there, whether it's your codeine kind of prescription medication, which metabolizes in the body just the same as heroin, whether it's your ADHD medication, whether you need to take Benadryl because you've got severe allergies, whether you've got a cold or a flu and you take pseudoephedrine, which on a side note is the base ingredient of methamphetamine. You know, that's the substance that methamphetamine is born from. Your tranquilizers, you know, benzodiazepines, things like alprazolam or Xanax or diazepam. You know, a lot of these medications are used for treatment of anxiety disorders. Medicine most certainly serves its purpose. What I always want to point out is if we have the parameters of our script, if we have a GP that we're working with, it's really important to remain transparent, because any one of us can find ourselves potentially self-medicating, taking an extra one, you know, making that sort of conscious decision to just have an extra one so you can sleep well tonight or whatever it might be. And it may just be a one-time thing. It can also become really problematic. And in terms of dependence, like I said before, there is an epidemic at the moment around legal drugs.
And it's a really important point, Ella, that the brain doesn't and the body doesn't know the difference between an illegal or a legal drug. But unfortunately, often the denial of someone that's on what they would label as a prescription form of medication, the denial, especially as it progresses into that category of being addiction, as Ella was pointing out, the justifications can be that much stronger, the denial that much stronger. So you've got to be really aware, you've got to work with your GP and whoever's prescribing this kind of medication and treatment as required.
Yeah. We'll move on to alcohol now, which is a really commonly used legal drug. So it's just, again, it's about highlighting the Australian guidelines and what's considered to be the safe advised limits. And there's two facts up there, and it's referring to two different kinds of drinking behaviours. The first drinking behaviour is your more regular or chronic sort of drinking. And according to the Australian guidelines, if an individual has no more than 2 standard drinks per day, but no more than 10 drinks per week, so that would equate to having 2 alcohol-free days a week, the chances of developing those long-term health effects associated with chronic drinking, cirrhosis of the liver, cancers of the throat and mouth, those health issues, it reduces the chances of developing those health issues according to the Australian guidelines. I always just want to throw in there that 0 is always going to be the safest bet, but according to the Australian guidelines, it's 2 standard drinks, no more than 10 per day, no more than 10 per week. The next fact is looking at binge drinking. You know, when we're looking at the alcohol being the second leading cause of, you know, preventable death in Australians in terms of substances, you know, it looks at, it both is that long-term health effect and also the binge drinking effects, the short-term physical harms associated with binge drinking, road traffic accidents, you know, violence, Domestic violence is strongly linked to binge drinking. Sexual violence is strongly linked to binge drinking. Misadventure, falling down the stairs, blackouts, alcohol poisoning. 1 in 25 Australians under the age of 1 in 8 Australians under the age of 25, are hospitalised due to alcohol. It's really an issue that we've got going on in our society. So what it says up there is if we have no more than 4 standard drinks in one single drinking occasion, if we choose to binge drink in one evening, it reduces the chances of coming across those situations. And I always just like to say it really candidly. If an individual, every time they get drunk, they come home and they have another verbal fight with their partner, or every time they get drunk, they black out and they lose their keys again, or they vomit on themselves again. Like, if there's always a consequence at the end of a night of drinking, what that guideline really sort of states is if you try and go out and have no more than 4 standard drinks, the outcome of your night will most likely change. This idea of really being able to help ourselves through this thing called life. Because, when I used to drink, I choose not to drink anymore, but when I used to drink every morning, the night after a night of drinking, I would be apologising to someone for something I said, or fixing that thing that I stuffed up, or whatever it was that I did. And the reality is that now that I don't drink alcohol, I don't have those problems in my life anymore. That I'm really able to help myself by just being able to look at these kinds of guidelines and trying to implement them in my life if I find myself, dealing with the consequences around substances, especially around alcohol. We do know as well, even in Australia, I'm pretty sure the bottle shop sales for the month of March this year in comparison to the year before were up 80%. I think we've all seen the news, the news reports of people lining up outside bottle shops, waiting to buy alcohol so that they can store it in their homes. So there's all these, especially during isolation, especially during times of heightened worry and fear, insecurity, this idea of drinking a little bit more to help get through the day. When do coffee hours finish and when do alcohol hours start? That's the sort of question that I've had a lot of people, sort of voice to me. These are all things, maybe we're not getting tested while we're sitting working from home, whatever it may be, there's less accountability and we can find ourselves drinking more. So these are really good guidelines just to be able to keep safe around our drinking as well, if we can keep to those limits. So it is referring to standard drinks. These are just indications, but it's always really important to know what a standard drink is if we want to stand a chance at helping ourselves. So about 30 mils of your standard spirits is a standard drink. It's got 10 grams of ethanol. That is what a standard drink is. That's what equates to a standard drink. So 30 mils of your average spirits. There are really, really strong spirits that are out there. So please, if you're having something like overproof rum, chances are, if it's 30 mils, you may be having more than a standard drink. On average, about 100 mils of wine. I always just want to point out that the little line that you see in a wine glass, that Plimsoll line, that is a serving suggestion. That is not a standard drink indicator. If you're using that to gauge a standard drink, please just know that that usually sits more at 1.5 standard drinks than when it does 1 standard drink, and it sits at 150 mils. So please just keep that in mind if that is something that you've used to sort of calculate your standard drinks. Sparkling wine, I don't know if you can even see, it's a bit glary there, but it's about half full in your average sparkling wine glass, a standard drink of sparkling wine. And, if I was ever out at a function and someone ever served me a glass that looked like that, I might have not been quite happy with what I was served. But the reality is that's more or less what a standard drink is. And it's just about being mindful. If you are at a function, or if you are out and you're drinking, you want to make sure that you keep to the guidelines so that you're not sort of, drinking too much while you're in isolation, let's say. Being able to know that if it's filled to the top, it's closer to 2 standard drinks than what it is 1. And then on average, your sort of pot glass of full strength beer is about a standard drink too.
And another important point there, Ella, is, in the current conditions of people isolating at home, Ella pointed out the alcohol sales, being up, people hoarding alcohol, just like we have with other supplies. The alcohol is there. People are more inclined to reach for it. There's less restrictions and boundaries in terms of how you manage your alcohol consumption. And I think, I certainly, again, from personal experience, when I used to be a drinker, there wasn't a glass of wine, if it was in a home environment, that would get poured to that level. So being mindful when you're pouring yourself a drink at home, just be aware of how much alcohol you're consuming.
Thanks, Anne. So these are just some early warning signs of dependent drinking, especially with the current climate as well. And this is an opportunity to self-reflect, but also if you see patterns in people that you care about. drinking on their own, drinking more than planned, you know, beyond the recommended amounts. You know, using those guidelines is a really great way of gauging whether we're drinking more than maybe what's healthy for us. You know, craving alcohol or making excuses to drink, putting aside other activities to drink, hiding alcohol or lying about how much someone has been drinking. Usually if someone is stopping to contemplate whether they have a drinking problem, it could be a sign that maybe there's something going on there. You know, if someone is continuously hurt, or if you feel like you're causing harm to people that you care about as a result of your drinking, straining your relationships, if you start blacking out and forgetting things, usually that's a bit of a sign that maybe your alcohol use, you know, just to be able to start a conversation with someone and say, I think it's getting a bit carried away, you know, in that moment. Being able to have the courage to do that means that it doesn't have to get to that really, really drastic, dangerous point of alcohol drinking.
And now this is something normally in our workplace sessions where we conduct what we call an alcohol audit, where it's got how many questions on it, Ella?
It was about 14, 15 questions.
14, 15 questions. And again, relating my own personal experience, I never identified with alcohol being a problem in my life. And I ended up going into inpatient treatment via my GP. And I remember vividly when I was filling in a questionnaire at the GP's, it asked me a question: did I have a problem with alcohol? No. Did I drink every day? No. And then how many standard drinks would I consume in a week? And it was 0 to 5, 5 to 10, 10 to 15, 15 plus. And, you know, for me, I thought 30 or 40 drinks, but it was only on a night or two a week. And I didn't realise the high risk category that my drinking was actually putting me in around my alcohol abuse alone. So, you know, we encourage you always to reflect on your drinking. Some of these things that we pointed out, really important at this time when we're all in isolation, or many of us are. If you are seeing changes in your drinking patterns and behaviours, to just be aware of it, to talk about it at home, and then try and employ some strategies into the home environment that put the right restrictions and support in place for yourselves.
So if you are concerned about someone who, you know, might be, you know, either using substances, or even, you know, a lot of these there's a lot of a blurred sort of line between substance use disorder and also other mental health disorders. And, you know, a lot of these can be just red flags. So it's just about, you know, what you would be looking for is if someone that, you know, all of a sudden you've started to notice these changes in them. And it's not just for a day or two, you know, it's a week down the track. And not only are those signs still visible, but they're usually getting worse, usually to the detriment of the individual. So if you start noticing these things, it could be a sign that maybe something deeper is going on. So whether it's dramatic weight change, weight gain, or weight loss, you know, in terms of the pupil effects, either that's usually a lot more substance affected. So your more constricted pupil, it could be because of opiate use like pain relief. Also, it could be because of heroin. Your more dilated pupil could be, you know, related to amphetamine use. A lot of antidepressants also create that effect in the eyes as well. Malnourishment or looking gaunt, you know, that could be because of substances. Tremors or shakes could be because of anxiety. It could also be because of amphetamine use. Slurred speech, skin wounds and bruises, you know, inability to heal due to substance use, but also maybe, you know, heightened, you know, in terms of being extra clumsy as a result of being fatigued because someone hasn't slept, because their anxiety's been running rife. You know, that could also be a reason why someone might start, you know, appearing with more bruises on their skin. A pale or grey looking tinge to an individual's skin. Clammy skin or excessive sweating. Again, excessive sweating could be because of anxiety, but it could also be because of amphetamine use. Bloodshot eyes, puffy eyes, glazed eyes. If you notice that in an individual, it could be because they smoke marijuana. It could also be because they've got hay fever. It's really important to always be very sensitive if you start to notice these changes in an individual. It could also be because someone's just been crying in the bathroom. Being able to know someone enough and notice that change and start a conversation with them then and there, you know, could really mean the world to that individual. If someone's constantly sick or with flu-like symptoms, if they're not taking care of themselves, or general lack of hygiene are also some physical symptoms. In terms of changes to behaviour, someone stops doing the things that they used to enjoy. And it's a really hard time because most of us have had to stop doing the things that we enjoy as a result of the lockdown. Whether going to the gym was the thing that made us feel better, whether going, you know, for coffee with a friend was the thing that made us, you know, feel better. You know, at the moment, a lot of us are not able to do what once brought us joy or helped us de-stress in the healthy kind of ways. That's why it's really important to highlight the idea that people may turn to alcohol or other behaviours to sort of get through this lockdown period. In terms of other behaviours, either really slowed reaction, speech and movement, or hyped, depending if it's around substance use. What kind of substance an individual used. May always look really tired in terms of their ability to sort of uphold their responsibilities at work. They may be calling in sick more often. And also it says unexplained absences. So whether it's someone in your household or someone that you work with who all of a sudden goes missing, especially if you are aware of a significant mood change before or after, it could be sort of directly linked to substance use, whether it is, they leave really tired and come back really awake, or they leave really stressed and come back really relaxed. These could be signs that perhaps there might have been substance used in their absence. In terms of their ability, their cognitive changes, forgetting things, struggling to do the things that they've always done. They might become more clumsy as well. They really struggle to really understand instructions. And a lot of the time people may start acting quite carelessly, unaware that they're impaired, and actually believing that they're fine, believing that they're functioning okay.
And Ella, at this time when, again, we're all experiencing restrictions and isolation in our own lives, often when we lose the ability to connect with work colleagues, it's really important at this time. We're encouraging people. We practice kind of the things that we teach as well. ADA, and I'll share this with everyone internally as an organisation, runs a daily check-in type call, video call, where everyone checks in on everyone's mental health and well-being and just seeing what's going on in their lives. And it's not work-related, but it keeps a sense of connection amongst people. And it's really important at this time because a lot of us, whether we're fully aware and understanding what it's doing to us, but we're losing our sense of connection as a result of the restrictions that are in place. So where we can, we encourage everyone to, although we've got, some of the restrictions have been lifted, and I think we can have groups of people in our houses now, but we encourage everyone to still find ways to connect with loved ones and friends and work colleagues as well.
Yeah, thanks, Anne.
Do you want me to go on this? Yep. Okay. So COVID-19, some of the questions that come up, and this really looks at that overall kind of anxious knot that this pandemic has put a lot of us in that I referenced earlier. Some of the things that are coming up for us all, how long will it last? Australia seems to have been, very unique in the sense of how we've dodged, the data that we've seen around a lot of the parts of the world, other parts of the world. When will work return to normal? Will it be months, a year or more? I think we're still very unsure of the impact of this and what kind of lasting impact this will have on the structure of work life for people. I think you'll find a lot of businesses actually maintain staff to work remotely. I think it will be, if ever at all, a long time before we get fully back to work environments being what they once were. So again, being aware of this stuff, it doesn't necessarily mean it has to be a negative. It's an opportunity to find, as long as you can keep some healthy routine in your home approach to work, it's a very unique time in the world where you get an opportunity to reconnect with things that maybe have a little bit more importance to you than some of the day-to-day things that we deal with through work. So again, we'll talk around how you can steer some of this stuff into a positive lens. How are we coping? Financial pressures, again, these macro influences that are often, out of our control. It's a reality looking at the unemployment figures that a lot of people are being directly impacted by this stuff when it comes to their employment. There's a lot of displaced workers out there, so financial pressures and insecurity are higher than ever. How are our children, coping at this time? It's a really big one, again, from my own personal experience. I watch a young 4.5-year-old boy that's normally doing kind of, preschool stuff 5 days a week, very connected with his little young friends, being confined in at home, all the time now. He's just a ball of energy that's not really coping that well. He's missing his friends and his connection with his routine that he's used to experiencing. So how do we cope with children that are struggling at this time, and how can we make sure that we support them through while supporting ourselves? So many questions, but so few answers. The coronavirus challenge, and this is what I was touching on earlier. And we put a quote in here: we don't get to choose our challenges in life, but we do get to choose how we respond to them. And this pandemic, I think, is something that is, again, unprecedented in the world, but it presents an opportunity for us to connect and support each other through a time in life where there can be a lot of good come out of this. Our opportunity to reconnect with important values and are important to connect with things beyond that, what is a lot of the time fickle kind of material surface things that we feel pressure around in our day-to-day lives. This has all given us time to reflect. I think we've often not really been able to find the time in modern day life to just reflect on life and reflect on values that are important to us. This presents a very unique time to be able to do that kind of stuff. The loneliness epidemic. Ella, I don't know if you want to go through these stats. This is some stats kind of pre-COVID-19, but we kept it in here today because it's something that certainly is of relevance now, and if anything is being heightened with the current kind of conditions that we're seeing in the world. I can go through these stats if you want, Ella.
I guess it's just really important to highlight that before COVID-19 even sort of, came into our world, there was already, quite a significant amount of Australians living on their own. So I can only imagine the sense of loneliness that an individual may be experiencing during lockdown when they have no one else in their household to be able to connect with. Just on that simple sort of front, really trying to create that understanding. The idea of feeling lonely has been something that's been throughout our community long before COVID-19 even came into play. And, the idea of not feeling supported, especially age group, 12 to 25, that age group in itself is a really trying time. And those Australians, those young Australians, have already experienced very high intensity of loneliness prior to all of this lockdown, prior to restrictions in being able to go out into the community and do the things that once brought them joy. And, the reality is that the impact that this can have on depression and other mental health disorders can very much, there's a huge correlation there. And it's important to have that snapshot before, because this is long before COVID-19 even came into play. And I guess for this situation here, even those most skilled and most prepared to live in isolation, there was a survey conducted with the researchers in Antarctica who are best prepared for isolation, who, have all of the sort of psychological support and know exactly what they're getting themselves into. This was something that they had calculated and planned, and they knew what they were walking into as they started their journey. And there's a lot of research that's come out of the life of someone who lives in isolation from the researchers, our Australian researchers in Antarctica. And every single one of them, despite all of the tools, all of the sort of approach that they've already, had in their sort of work and their sort of best ways of best preparing for it, at about the halfway mark, it's called the third quarter phenomenon, there was just an overall experience of low mood and increased tension and low motivation for those workers, highlighting that no matter, sometimes, especially during this isolation, the emotional roller coaster that is trying to navigate through this to the best of our abilities can feel really like it's weighing us down. That's my experience too. All of a sudden, I don't understand why I'm feeling like this. Nothing's changed since yesterday. Why am I feeling low today? And it's really nice sometimes just to hear that the professionals who live their life in isolation on a regular basis, this is a common occurrence. It's a human experience. And sometimes it just makes me feel better to know that this is just what happens. This is part of this process of lockdown and isolation. And it just means that it's that little bit more okay. And it just means that I don't have to worry because I'm feeling like this. It means I can accept it that little bit more, and it doesn't make it worse. A lot of the time, if I can just know that any human being, most of us will be going through this, and it's just part of this process. It means that we can let it go just that little bit. Things like positive thinking, reminders that just like anything in life, everything passes. It will end. Sometimes we lose sight, sometimes we can't see the light at the end of the tunnel, but it will end. We will find a sense of normality. And if it means that we just get used to the new norm, then that's what it will be. But as soon as we sort of accept that and let it go, again, it's something that we need to be able to try and adopt to the best of our abilities to navigate through this, acceptance, just rolling with it. If it's a situation or a problem comes up that I have control over, it's about trying to approach that and, you know, have that problem-focused coping. You know, the idea of trying to change the things that I can, but if there's, you know, the emotion-oriented coping is the things that we can't really control, but being able to accept that, or being able to sort of be kind to ourselves as we roll through whatever it is that life's thrown at us that we may not have a choice in. And trying to bring it back to the moment, practice mindfulness, all those kinds of things to navigate through, and try not to turn to those negative behaviours to get through that to the best of our abilities. Structure and routine is really important. Have a wake-up time, no matter whether it's a work day or a weekend, even though you're still staying in the home. If you are working from home, let's say, try and wake up at the same time, you know, go to sleep at the same time, try and change out of your pajamas, try and make sure you shower in the morning, try and have breakfast at the same time, having that structure, allocating time to, you know, doing things even like meditation, yoga, exercise, mindfulness, you know, really making those things a priority. These are the things that we can implement in our lives, no matter where we are, whether we're out working, which I always, when I'm really busy before lockdown, you know, I didn't have time. I'm too busy to stop and do some meditation. That was usually my thing. And, you know, for me personally, as a result of this lockdown, for the last 4 weeks, I have meditated every day, you know, and it meant that I can just slow down. It means I can bring it back to the present moment, and I can just remember that I'm actually okay at the moment. Using this opportunity for personal growth. Sorry, Anne, I'll be 1 sec. Using this opportunity, the extra time that we may find ourselves having on hand, and trying to direct it towards personal growth is also proven to help improve mental health. You know, it's really got a lot of great mental health benefits. Using this time and letting it be a motivation to try and better ourselves. And that can be just as simple as picking up a new hobby, or doing the gardening that I've wanted to do for ages but I haven't had time to do, or, you know, whatever it is. You know, for me, it's, you know, even implementing meditation on a daily basis. You know, that's one of the things that I've done as well.
Thanks, Ella. And Jim, mindful of time, just to kind of you know, support what Ella was saying there. So in terms of just, you know, dealing with the current climate that we find ourselves in, that healthy routine is so important. Acceptance is so key, you know, and it's very true when dealing with addiction. So rather than turning to those artificial kind of negative solutions that we might find comfort in, temporary comfort in, like drinking or using drugs, things do pass, as Ella described, and acceptance is such a powerful tool in addiction treatment and recovery as well. But then at this time, you know, going beyond just the coping mechanisms and how you can actually reintroduce some more meaningful things into your life, as Ella gave us the example of that daily meditation. It's a wonderful one. So Jim, I'm very conscious of the time now. We're up to the finish line. We had a few other slides to kind of take people through. Again, just really extensions of some of the stuff that we've gone through today. Ella touched on some of this stuff around working remotely and some of the things we need to be aware of. I mentioned around introducing some things to stay connected with those that you work with family and friends as well. Utilize, you know, Zoom as a platform. I think it's a business that's a $40 billion company now, and it's one that's really kind of you know, grown out of the current challenging environment, but utilize those types of tools out there to stay connected with people.